This is Crystal Fenn with MedPage Today. I'm here in San Francisco at the American Psychiatric Association meeting, where researchers have reported that borderline personality disorder may be underdiagnosed. I spoke with David Meyerson of DePaul University in Chicago about the implications of these findings.
Well, we found that borderline personality disorder is underdiagnosed in the general population, and that it's often misdiagnosed for bipolar disorder, major depression disorder, post-traumatic stress disorder, as well as other anxiety disorders, among other Axis I disorders. And also that treatment for borderline personality disorder is often related to misdiagnosis, and there's a high rate of polypharmacy for treatment of borderline personality disorder, although more the gold standard of treatment is psychotherapy.
Meyerson said there may be several reasons that account for the underdiagnosis of borderline personality disorder found in their study.
Underdiagnosis we found is often related to past misdiagnosis of the disorder, mainly due to the complexity of diagnosing borderline personality disorder. There are 9 symptoms of BPD in the DSM-4, and individuals qualify for the disorder if they meet 5 of the 9 criteria. So in essence, you can have 2 people who overlap in only 1 symptom but still both have BPD, which makes the diagnosis rather difficult when you have 2 people who can present very differently. Well, research has shown that the symptoms that overlap between borderline personality disorder and other disorders such as bipolar disorder or depression or others, although they overlap superficially, there is a more in-depth qualitative difference between or among the symptoms. So, for example, the impulsivity found in patients with bipolar disorder and borderline personality disorder is really qualitatively different. Also, the suicidal ideation or behaviors among those with major depression and those with BPD is also qualitatively different in form of lethality or the reasons behind the suicidal behavior. And these are just 2 examples of symptoms that overlap among major disorders, but there is that qualitative difference. Also, another clinical implication is that many clinicians often use unstructured interviews when diagnosing or first assessing their clients. And research has shown that using more structured semi-structured interviews for diagnoses have been found to show more accurate diagnoses, particularly among populations of people with borderline personality disorder.
So simple measures such as using a structured interview may help with the underdiagnosis of borderline personality disorder, although further research is needed. I'm Crystal Fenn with MedPage Today in San Francisco at the American Psychiatric Association.